We're excited for you to join today. My name's Rachel Browner, and I am the program coordinator for our OneOp team. And it's my pleasure to welcome you to today's session on how your zip codes shape your health, mapping determinants and outcomes. In case you're joining us for the first time, I'd like to give a brief tour of our webinar platform so you can find your way around. Hopefully, you're currently able to view the slides that we're sharing, but if you're unable to see them or if you have any other difficulties throughout today's session, please email us at contact@oneop.org for tech support. And as some of you have already done, we look forward to having you join us in that chat pod for conversations and questions. So to embed that chat pod so you don't miss any links or conversations, simply place your cursor over the shared slides. From there, you're going to see a toolbar pop up across the bottom of your screen. From there, just click the chat bubble icon. And when typing questions or comments, please be sure to select the Everyone from the response options drop-down menu so everyone's able to view them in that chat pod. And please note that the slides and resources are available for download. There should be a link in the chat now for you to go ahead and download those slide decks on our event page for today's session. And so we're going to be covering continuing education information, which we're offering several CEs for today's session. We're going to cover all that information at the end of the webinar today. So please stay tuned at the very end. If you're interested in continuing education credits or just a general certificate of attendance, we'll be providing information at the very end. And then also please note that closed captioning is available for this webinar, and you can turn on the subtitles via that Zoom toolbar. And please, let's make this platform personable. Even though we can't see you or hear you, let us know where you're joining us from. I love seeing that in the comments. It helps make the presenter get an idea of where everyone's joining us from. So we appreciate those that have done that. Please continue to do so in the chat, just to let us know maybe what organization you're with. I love seeing the different universities, showing which state you're at. So please let us know where you're joining us from. And again, that is the area where you're going to be able to ask any questions or comments as well. All right. So thank you for joining us. We continue our partnership with the Department of Defense and the U.S. Department of Agriculture to expand that readiness, knowledge, and networks of the professionals supporting our military service members and their families. The views expressed in this presentation do not necessarily reflect the official policy of the Department of Defense and the U.S. Department of Agriculture, U.S. government, or OneOp, and the mention of any entity or product is for informational purposes only. I'm excited at this time to introduce our presenter for today. Dr. Morgan Foster is a great colleague here at Texas A&M AgriLife Extension Service with myself. She is an assistant professor and extension specialist with Texas A&M AgriLife Extension Service, where she specializes in disability and health. In her current role, Dr. Foster serves as the program manager and co-PI of a statewide disability community coordinators initiative in partnership with the Texas Council for Developmental Disabilities. With over 8 years of experience in extension, Dr. Foster leads efforts to expand and strengthen extension programming that supports individuals with developmental disabilities and their families. Additionally, Dr. Foster's public health efforts span across chronic disease prevention, health education, and disability health, with an emphasis on advancing health outcomes for various populations. We're very excited for Dr. Foster to share her expertise this morning. And at this time, I'm going to go ahead and pass over the presenter reins to her. Dr. Foster?
Thank you so much, Rachel, for such a wonderful introduction. All right. I have control. We are going to get started here. So thank you all today for joining this session. And this session is all about understanding how where you live shapes your health and what we can do about it. And so if you did not know, your zip code is actually a better predictor of your health than your genetic code. So I am so excited to share my presentation about how your zip code shapes your health. And today we will cover a few different things, but one, we will define the concept of social determinants of health and how they influence health outcomes. Then we will interpret some community level data to identify priority health needs. Then we will explore some practical tools and resources for addressing social determinants of health in your communities. And lastly, we'll work through a quick case study to map determinants and translate findings into some actionable steps. And so I'm really excited about this topic and to have this conversation with you. And so please feel free to drop questions in the chat as we go. I want this to be interactive, and I'm grateful for you all already being interactive this morning. So, some of you have already dropped in the chat, but if you have not yet, please drop in the chat, where do you currently live? And you can mention your city and state. And so we have folks joining from all over today. I see Texas is well represented, some folks from the East Coast, the Midwest. I've seen Pennsylvania, Minneapolis, Houston. I am actually here in Houston, Texas as well. So great to see other people from Houston, Virginia. All right, New Jersey. We are all over the nation this morning. And so I'm so grateful for y'all coming and joining today. So my next question is, do you live in the same town or city you grew up in? And bonus points if you share how far away you moved. And so this could be a simple yes or no in the chat. But bonus points also share, I moved 4 hours away, 500 miles away. I see I'm in a whole new state. I'm in a whole new country. And so, a little bit about me. I grew up in a town called Lancaster, Texas, around the Dallas area, and I now live about 3.5 hours away, or 4 hours with traffic here in Houston. And so, I'm seeing quite a few people move, but then actually, quite a few people did not. A lot of people are pretty close to their hometown of where they grew up. I see some things as far as 13 to 14 hours, 24 hours away. That was quite the move, with a lot of us who joined here today working with military families. I'm sure you've moved quite a lot over the past few years of your adulthood. So you may have moved quite a bit. 5,000 miles away. Angie, I think you are the furthest person to move. And so, a quick stat here, nearly 60% of young adults live within 10 miles of where they grew up, and 80% live within 100 miles. And this is according to a study by the US Census Bureau and Harvard University. So, while many of us move, most don't go too far. But people move for different reasons. Some of this is driven by jobs, school, and marriage. But what's interesting is it's rarely driven by health. Yet, where we live matters as we age. So, very seldom do people think about moving for the sake of their health outcomes, but where we live becomes a bigger factor for our health as we continue to age. And so I want you all to keep in mind those locations you dropped today, whether that be your hometown, where your formative years were, or where you currently live now, or where you spent a lot of time throughout your adulthood residing. And so, just to think a little bit more about some quick stats here in the United States, we are aging here in the US and we are living longer than ever. And that's good news. But it also means that as the aging population is growing, things are changing. And so, back in the year 2000, there were 35 million older adults aged 65 and older. And this is according to a study by the Administration on Aging. 35 million, making up about 12.5% of the total US population. Today, as of last year, that number has grown exponentially to 61.2 million, making up about 18% of our total US population. almost 1 in 5 people are an older adult age 65 and older. And by 2040, this number is projected to increase and reach a whopping 78.3 million, which will make up about 22% of our total population. So, yes, we're living longer, but it also means that as the aging population is growing, that means the number of caregivers are growing, and those caregivers are also aging as well. The total number of older adults with disabilities is continuing to increase over time, whether that be those with hereditary disabilities or those of us who will acquire disabilities over time. And if you live long enough, you will acquire some form of some type of disability. But how does that impact our health? Well, where you live can dramatically shape your life expectancy. And so you all just dropped some information about where you currently live, and I want y'all to keep that in mind for these next few slides. So the current US average life expectancy is around 78.4 years of age, but state differences are quite striking. And so if you notice in the map I am showing, there is an area of darker blue colors representing a higher expectancy rate or average life expectancy. And then those colors that show that more pinkish reddish color are those with a lower life expectancy. Hawaii actually leads the United States with the highest life expectancy at 80.7 years of age. I saw quite a few people from Hawaii or living in Hawaii currently. And then Mississippi trails at 70.9 years of age, an almost 10-year difference across the United States. However, if you look a little closer and note the map color differences, although Hawaii leads at 80.7, you'll see this pinkish and reddish color happening there in the state, which means that average is not the same for everyone within that state. For some, it's dramatically lower because zip codes tell an even bigger story. Even in Chicago, there's one neighborhood that averages about 84 years, while another only miles away averages about 60 years of age. So if we zoom in even closer to the great state of Texas, I saw there were quite a few people in the chat that are here from Texas. The current average life expectancy in Texas is 75.4 years, which is below the national average. But the highest ranked life expectancy by zip code here, so remember zip code, is actually in a town called Hutto, Texas, where the average life expectancy is closer to 97 years of age. What's interesting about this zip code is the median household income is well over 100,000 at 115,000. The poverty rate is about 6%. And a lot of people move here who have retired. It's a really affluent suburban community right near Austin, Texas, has really great access to quality health care. There's a lot of high rates of education levels and so on. And so it's a pretty good place with a lot of high level of resource. And so that's a really high average life expectancy there. And so if you live anywhere in Texas, you may want to consider retiring in Hutto, Texas, home of the hippos, by the way. Random fact to know about Hutto. Quite on the opposite side of the spectrum, the lowest life expectancy is actually a small zip code inside of Fort Worth, Texas. Fort Worth is huge and encompasses quite a lot of residences, but this zip code 76104 has a life expectancy of only 66.3 years. That is a 30-year difference between Hutto, Texas and Fort Worth, Texas, yet we're all in the same state. What's interesting about this zip code is the median household income is almost half at 56,000. And the poverty rates are closer to 33% below the poverty line. And so, despite their access to major hospitals in the Fort Worth area, their neighborhoods lack local grocery stores, pharmacies, and clinics. And there's a higher rate of chronic diseases such as heart disease and diabetes. And so when you think about the systematic factors that contribute to this, zip codes definitely play a part. Then we're going to zoom in even closer. I mentioned earlier that I live here in Houston, which is Harris County. Harris County is humongous. It actually makes up 16% of the total Texas population. That is how many people live here in Harris County. Huge, huge, huge county. And the average life expectancy here is 78.9 years of age, but that ranges across the county because of what? Zip code again. So the highest zip code is 77073, which is about 89.7 years. And then its lowest zip code or lowest life expectancy average is 77026 at 69.8 years. You're talking about a 10-year-ish difference between one county of life expectancies. And so here you'll see a very similar thing where the median household income of that higher life expectancy zip code is much higher, and then the median household income for that lower one is in half also too. The demographics here don't really play a part as far as race and ethnicity as much, but there's a lot of things that play a part in the areas we live in. Rachel also just mentioned in the chat that for Texas, Harris County also has the largest veteran population. And so some good stats to know there. I also see a question that says, what about New Jersey, Florida, and California? And I can share I will be sharing some tools later about how you can find this information for the states that you may work with or live in as well. So that's coming soon. And so looking at this chart, that Texas chart or that national chart, tell me in the chat what is surprising you the most about these differences between zip code. Is any of this shocking? Someone mentioned it seems us southern states are doomed. The dramatic difference in number of years. And I'm going to assume, Teresa, you mean the number of years with the life expectancy average. It's surprising that even neighboring towns can have vastly different life expectancies from Hope. Yes. So, yes, I think you all are making some really great points. And so these gaps aren't random. These gaps are actually driven by social determinants of health. And we will dig into what those are. And so, what are social determinants of health? These are the conditions in the environment where people are born, live, learn, such as the schools you attend, the availability of colleges and universities, and so on, where people work, where people play and engage in physical activity, where people worship and their alignment with faith-based institutions, and where people decide to age. These factors shape health outcomes, and most are things we cannot fully control. And so there are 5 domains that impact our health. We're thinking about those social determinants, and we will cover these 5 domains today. And so those include economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and the social and community context. And so I've seen some comments in the chat that also mentioned a few of those social determinants that we will mention, such as food wastelands, education, proximity to pollution, and things like that. So let's start with the first of the 5 domains, economic stability. So where you live affects your socioeconomic status and can impact your access to income and employment opportunities and even housing options. So, for example, if you live in a rural area, do you have the same job opportunities as someone in an urban area or vice versa? Even with thinking about housing choices, do you currently rent or do you own a home? If you own a home, do you own a single family home or a multifamily home? These are all things tied to our zip code economics. This can also impact your access to food and healthcare affordability. So, for example, is your local grocery store an HEB if you're here in Texas, a Walmart, a Whole Foods, or the local dollar store is the closest access you have to a grocery store? Lower income often means increased risk for chronic diseases because of these factors. With thinking about that second domain, the education access and quality domain, zip codes can influence a lot when it comes to educational attainment, and this can impact our school qualities and our literacy rates. And so, thinking about your hometown, where you grew up, how large of a population did you grow up in, and how big of a school district did you grow up in? So, for example, my hometown, there was one school district, and it was a district that fed into one high school. And so there were multiple elementary schools, but there was only one junior high or middle school, and there was one high school, right? So a smaller suburban town. Versus, did you grow up in a town where you had ample access to multiple options for elementary school or multiple options for middle school, and then you had a choice of 10 different options for high school once you got to your high school? Like here in Harris County, there are some cities that are that big where there are almost 6 to 8 different high schools in one area. And that's not even in one county, that's just in one city. And so thinking about that, but also thinking about the quality of those educational options. And so for example, low literacy can also limit your job opportunities and increase your risk for poor health decision making. So, how might your educational level impact decisions like your options to get vaccinated or follow up on care? This all relates back to those literacy rates. Health literacy is so important. I see Catherine mentioned in the chat, health literacy is important more than understanding what we do, but actually implementing what you're educated on, exactly that, and following up with that care. And Stefan mentioned, how do we prove our area is with funding in order to have health providers think it's worth coming to our zip code? And some of that is impacted by policy and advocacy decisions. And so we can talk about that a little bit too. But yes, think about those educational access and quality factors that impact our health too. The next domain, care access and quality. Proximity matters here again. Where you live can impact your access to healthcare, and this can include your access to primary care physicians, preventative care such as screenings, your access to specialists, and even life-saving measures. So, for example, for you currently, how far is the nearest hospital or emergency room from you right now? Is it a quick 5-minute drive or is it a 30-minute care flight? If you're in a more rural area, I see about 30 minutes, 5 minutes, 15 minutes, 5 minutes. Across the street, you are in a great location. 7 minutes, 15 minutes, 25, 15, 20 to 30, depending on who's driving. Great point. I work at a hospital from home. It's 12 minutes. Better area, 1 hour. And Michelle, that's a good point when thinking about the quality of the care. And so, are you easily accessible to your local quick kind of clinic, or do you have access to a more quality care emergency room that may be a little bit further? 20 minutes to an hour, depending on traffic. These are good things to be aware of when you're making these decisions on where you decide to live. And I mention this because this could be a matter of life and death for some people, depending on what you need access to that care for. Rachel mentioned that her family lives in a more rural area, and it's about 45 minutes for them to get to a decent hospital, and that's very relevant for here in Texas. I know some people have to travel 30 to 45 minutes to an hour, or to see certain specialists, they have to travel overnight to another town. Anna mentioned from home over an hour to a hospital that has a OBGYN department. And so with thinking about those specialists that we need care for annually, how far do we have to travel? For those who are expecting families who may be thinking about childbirth and so on, how far do you have to travel to even be able to get that kind of care? Catherine mentioned a good point. How many bus changes do patients make to get their care provider? Great questions to ask. And so, thinking about that, rural and low income zip codes often face increased mortality risk because of these barriers to transportation or these barriers to care for specialized services. And when you add on being an older adult or being an adult with disabilities, there's added barriers and challenges that we are faced with as well. I also want to mention that insurance costs can sometimes vary by zip code. This, of course, can vary depending on your employer, but sometimes these zip code related insurance costs can vary dramatically depending on if you are in a rural area versus a more urban environment that has more access to more clinical care. So there's so many factors that can impact our health. Another comment was mentioned that not just insurance costs, but also Medicaid and Medicare providers. Great point. And this is very dependent on your zip code. So our next domain is the neighborhood and built environment. Where you live can impact your access to, do you live in a area that is deemed safe, or do you live in an area that is more crime ridden or has a higher rate of crime events? That's some things to think about too, and that also can impact your health. Do you have access to parks or trails and gyms for physical activity? And so, where is your nearest trail or park and rec center or gym? Is this a walk across the street? Is this a 5-minute drive down the street? Do you have transportation to get there? Is it a bus ride away? Is it a bike ride away? Or do you have to travel pretty far to get to a park or rec center or a trail? I see some people have mentioned 5 minutes to drive to the gym. A great point was mentioned in the chat. Access to ADA compliant trails and parks is a whole nother issue. And this is true, and also a point about our neighborhood and built environment. If you are familiar with zoning laws here in Texas, sidewalks are only permitted for, it depends on your city regulations, but there has to be a business, a home, or something set in front for there to be a sidewalk. And so walking in Texas, you may walk down a sidewalk and then for the next 2 miles ahead, there's no sidewalk in sight because there is no park, business, or residence. In Texas, it's getting better, but walkability areas are limited. Great point. 5 to 10 minutes, but requires a vehicle and does not have bus access. Great point. So yes, it just depends sometimes. Your neighborhood and built environment also impacts your exposure to environmental risk, such as increased risk for air pollution or poor water quality. So, for example, the zip code I mentioned earlier in Harris County with the lower life expectancy, they are closer to industrial areas with higher cancer risk because of the air pollutants and water quality, too. And so those things can weigh and have an impact too. Or have you ever gone anywhere for those of us who are asthmatic or allergy ridden and your allergies are heightened depending on where you are, or your asthma is flared up depending on where you are? And so I have a few people who've mentioned great parks where I live, but the region has poor air quality. So, yes, you do need parks and exposure to great environmental spaces to be able to have good air quality. And then another aspect to think about is food deserts versus fast food swamps. And so I saw a question pop up there. Food deserts refer to your areas that have limited access to healthy food options. And you've probably heard this term quite often. But are you in a fast food swamp where there's an abundance in access to unhealthy food options, making unhealthy choices easier than those healthy ones? And so, for example, is it easier for you to reach your nearest McDonald's or your grocery store? Which one is closer in proximity to where you live? And so I have someone who's mentioned they live in a fast food swamp for sure. On your street or within 5 miles, do you see a McDonald's, a Taco Bell, Burger King, and so on before you see your local grocery store? These are all things to think about and consider. Okay. And the last domain to think about is the social and community context. And so, where you live can also impact your access to support networks, and it can increase or decrease your risk for social isolation related outcomes. So think back to the very beginning. I asked you, do you live where you were born? And when you think about your access to your social networks, networks change as you age, but they also change as you move. And so if you were to have an emergency today, is help 5 minutes away or is it 45 minutes away? Or if you need help with access to childcare, or you just need someone to go get groceries for you because you are at home sick today, is your closest family member or friend or loved one down the street? Or would they have to travel in to be able to provide you with support? So these are also things to think about as well. I have one comment that mentioned I'm further away from everything and everyone now, and it's a huge adjustment. And it definitely can be. And for those of us who work for military related organizations, or you work for education related organizations and so on, you often move because of work. And that does create a distance in your social networks. And so you're recreating what social networks get to be as you continue to age and your family moves and so on. Francine mentioned she's developed a social network over the years, but your husband is very shy and has struggled to connect and make new friends. Stigma also plays a large factor of social isolation in healthcare. And this is a great point because thinking about those who are older adults or those who are adults with disabilities, depending on their options for mobility, mobility can play a role in transportation and your access to social networks these days and what community gets to look like for you. But these can also impact our health too. And so, as we're thinking about all of these factors, as practitioners working with diverse communities, where we live shapes our health outcomes, but how do we see and measure these differences? And so there are tools to make this a little bit easier. And so I did want to provide you all with a few of those tools. And so if you want to sit and map some of those disparities that your communities may be facing, you can do so. And so one of those tools is called Places, CDC Places Map. This is a interactive tool that provides local health data by county and by zip code. And you can utilize this interactive map to be able to click around and choose data, zoom in on the state, zoom in on the county, zoom in on the zip code, and it allows you to rank a lot of different health related data there too. It's great for identifying chronic disease prevalence, health behaviors, and social determinants. Crystal mentioned, can we provide the links in the chat? And Rachel mentioned that the slides are available for download, and you can click on this slide to be able to access this link. Another great tool to use is the Healthy People 2030 goals and objectives. And so the US government comes out with a plan every 10 years that provides a national framework for us to use as practitioners on goals and objectives to address social determinants of health. So we're 5 years into Healthy People 2030, but you can think about these to use it to align your community priorities with national benchmarks. Okay, we can make sure that that link is updated too on those slides. And then one more great link to use is the Spark Map Vulnerable Populations Footprint. This mapping tool highlights areas with high poverty or low poverty, low education rates, and other social determinants of health indicators. And it's a useful tool for identifying resource gaps and planning interventions. And so there's a lot of tools that are still available that utilize some state and national level data to be able to drive those points home, to see them a little bit more holistically across the span of multiple zip codes and counties and states. And so now that we have a little bit more awareness, a little bit more data, how do we translate that into action, and what steps can we take to make a real impact? And once we know all of this information, how do we actually address social determinants of health? And so too often we stop at the information dump stage without providing tools for what comes next. Awareness is important, but action is what changes outcomes. And so that's what this last half of the session is going to talk about. We'll talk about how do we interpret community level data and turn it into health priorities and actionable steps. So one way we can interpret some of this community level data is first by using evidence-based tools and public health models to organize and interpret the data. So I want you all to remember one of my favorite phrases of all time is you don't know what you don't know until you know. And so taking the time to dig into this data to find out what's going on in the communities that you serve allows you to be a little bit more prepared to identify and prioritize those health needs for your community. Step 2, you want to identify key social determinant of health issues and root causes. And so once you have the data, dig a little deeper and think about those 5 domains to apply to see what social determinants are really driving some of those poorer health outcomes that you may see. So if you see higher rates of disabilities or higher rates of diabetes, cancer clusters, asthma, or other chronic conditions, ask yourself what environmental or social factors are contributing to these patterns. Understanding the why behind the numbers helps you move beyond the symptoms to root causes. And then step 3, we want to prioritize and plan. So after identifying the issues, we want to rank community needs and plan for action. So here's the reality. We can't solve social determinants of health challenges overnight. Many of them require policy change and advocacy to address systematic problems that we do not have control over. But in the meantime, awareness helps us problem solve quickly and make meaningful improvements with the resources we have access to. So, what can we do with what we have? And that is where I want to get into community asset mapping. So, one powerful method is community access mapping. I have a question in the chat. How do we make sure that there is data being looked at that isn't just the good stories or success stories that seem to be used to deny funding? Great question. And so that is where you want to dig into some of those health outcomes that may not show the good stories. You want to identify those priority health needs that may be the negative issues that may show that increased risk for heart disease, diabetes, and so on. You have to justify showing the need to justify the need for funding or justify showing the historical need. And so maybe you pull some more recent data that shows a pretty good story, but over the past 10 to 15 years, it has barely made a shift or change for improvement. And so you want to take the time to look at those big picture health outcome items and look at them over time and compare them over time too. So, community asset mapping. This process is a really great process to have in your tool bank. It's something you probably naturally do quite often, but putting those pieces together kind of helps too. And so this process helps identify how social and environmental factors affect health outcomes across regions. It helps highlight the visibility or lack of community assets and resources. And it helps provide practical tools to improve health outcomes. And so there are four main steps to community asset mapping. One being mobilize. As we talked about before, you want to determine that health need. Review that county health ranking data and local data to identify priority issues. Then, two, you'll move into assessing and being able to identify and gather community assets. And those assets are your community strengths. And so, thinking about what organizations, resources, agencies, grassroots groups help address some of those needs that you identified. And then step three, you'll want to plot and organize and map that data. Literally create a map to show where resources are located and what gaps exist. And then step four, you'll want to strengthen those connections and take actions. Share those maps, build partnerships, increase access, find out about resources that you did or did not know even existed. So we're going to work through a quick case study example to apply this to some practical strategies. And you can imagine the community that you are in, the community you serve, maybe the military installation you serve, the VA center where it's located, and so on. So the case study example we're going to use, we're going to come back to Texas. We're going to go down to East Texas to a small town called Marshall, Texas, that is inside of Harrison County. It has a population of about 23,000 people. And the health challenges there include high rates of chronic disease, limited access at times to affordable food options because of transportation barriers and other things, and then increased social isolation among the older adults and adults with disabilities there. And so, how do we apply asset mapping here? Well, we're going to look at each of those 5 domains that impact our health, and we're going to identify some resources. Has anybody heard of Marshall, Texas? I have one person in the chat who mentioned that they're about an hour away. Okay, we have a few. Marshall, Texas is on the map. Woo-hoo. Someone has visited Marshall before, so they can see how those barriers do indeed exist. All right. So we're going to go back through those 5 domains. So we're thinking about economic stability. We're going to take the time to identify resources. So that may be identifying job readiness and career development support, which could lead to increased access to improved income status levels, which ultimately leads to improved health and well-being. We also may identify local food pantries that could increase access to healthy food options, especially with Marshall, Texas being one of those places that is a food desert and a fast food swamp. And then we're going to find access to literacy and budgeting classes. This is kind of a economic stability and educational access domain piece, but we may find access to local credit unions or the local county extension office to help support some of that economic stability literacy. Then moving to the education access and quality domain. Marshall, Texas is a small town where there's only so many elementary schools, middle schools, and the high schools that are available there. And so some of this may also be finding the county extension office to find out about the nutrition and health education classes that are offered through there or other agencies that provide education. And again, as we talked about earlier, this could improve some of those health literacy rates and improve some behavioral and health outcomes. This also may be attained through access to the local public library and understanding what resources are offered through there. So we're going to map those resources. Then we're going to get into our healthcare access and quality. We're going to take the time to identify our local primary care clinics, our emergency service providers, our pharmacies, and we'll even know where our 211 and United Way resources are as well. And we're going to plot those and know where they are located and how they provide resources to our community. And then we're going to think about our neighborhood and built environment. Again, Marshall, Texas, there are issues with transportation barriers and so on. And it's a more rural area, so you do quite often have to drive to locations or take the bus to locations, and limited walking ability and things like that. But we're going to take the time to identify local community gardens and farmers markets that we may have easy access to. We're going to find the local parks and recreation centers and determine plans of actions to how to get to them. We're going to find our local trails. And then we're also going to consider what are the city transportation options? Do they have options for paratransit for those folks who are older adults or adults with disabilities? And then lastly, we're going to think about that social and community context. So we're going to locate all of the local volunteer hubs. We're going to locate the faith-based ministries that do community outreach. We're going to find our local health coalitions and agencies. And we're going to find our social clubs and groups that may provide access to resources and opportunities as well. Something we do quite often as practitioners is we have this laundry list of resources, right? But how often do we take the time to match up those resources to the actual priority needs in the community? And it's just taking that time to really see what are the strengths in the community, where are the gaps, and how can we communicate that information with those that we are working with. Comment was mentioned. I haven't seen the public safety organizations such as police, fire, and rescue. And that's a great point and option to think about as well, especially with thinking about our access to the neighborhood and built environment, healthcare access, and so on. Where is your nearest police department? Where is your nearest fire department? And so on. This is especially important when thinking about emergency response and disaster preparedness, and how involved is the community with making sure that they are aware of those access points. And so thank you for bringing up that point, and especially in more rural areas where there may be a lack of access to those first responders. And then one more thing to think about with asset mapping is the individual asset mapping that we can do as well. So, I mentioned earlier, we can't control those social determinants of health quite often because, again, they require policy change, advocacy, time, and patience to really see those changes happen. And so, we can do our community asset mapping to try to address some of those barriers that we're seeing, but what we can control at the individual level is our individual health behaviors and lifestyle choices, such as our individual choice to engage in healthy eating, to engage in physical activity, to engage in preventive care such as vaccines and screenings, or to make those efforts to stay socially connected. And so, through community asset mapping and individual asset mapping, we can kind of start driving the force to address some of those social determinants of health, despite what we can or cannot control. And so, again, although not every factor that shapes our health is within our control, we can decide how we respond, collaborate, and build upon what already exists. And then, one more thing to think about also is that community asset maps offer strategies to identify resources and assets that can help address health outcomes and enhance health promotion. And with that, I will open the chat to any other questions you all have or want to think through, or thoughts that stuck out. And if you would like to chat with me more, you can definitely email me at morgan.foster@ag.tamu.edu.
Thank you, Dr. Foster, and thank you for a great presentation going through everything. I want to also send a big thanks to our participants. We really appreciated the engagement in the chat, the questions, just even the comments based on Dr. Foster's questions and your participation. We really appreciate your engagement. And Dr. Foster, thank you for sharing your expertise today. If there are questions that come through, we'll get back to them. I did want to briefly touch on some housekeeping items at the very end, because I know that's always a big thing for folks before you leave today is continuing education information. So this webinar has been approved for one continuing education credit. And also it's approved for certificates of attendance. So for those of you that are just needing a certificate of attendance, no CEs, that option is available. You will be required to complete a survey. So you are going to go to our event website, where we've been sharing the download slides, or a link to download the slides. You're also on that event page going to be able to find a section. If you scroll down, there's going to be a continuing education section. From there, you should see a continuing education purple button. If you don't see that, go ahead and refresh your web page, or just give us a second for our IT group to get that posted. But you will complete a survey. From there, you will be taken to a list of CE offerings that's available. Please select one or more, whichever you need. and you will then be sent an automatically generated email certificate. If for some reason you have any issues with your certificate or accessing the CEs, I'm going to go ahead and pop in my email address, my direct email address in the chat. Feel free to reach out to me if you have any questions regarding CEs, if you're having any tech issues with receiving those automatically generated email certificates. I'm happy to help in any way I can. So reach out if you need that. Also, please join us next month. I can't believe we are coming up on December, but December 16th, we are going to be partnering with a representative from FEMA, and the presentation is going to be from 11 a.m. to 12 p.m. Eastern Time, similar as today. And the presentation that we're going to be focusing on is disaster preparedness for providers supporting individual disabilities. And so we really want to focus on emergency planning, especially as this winter rolls around. They're going to be covering risk assessment, person-centered emergency plans, continuity of care, accessible communication, coordination with local responders. So please get connected. Thank you, Amy, for posting that link in the chat. So if you'd like to register for December 16th event, as we partner with FEMA, go ahead and click on that link and get registered. And for any and all of our OneOp offerings, we still offer some great webinars throughout the year, upcoming events, articles, any resources, any online courses. Get connected with us at oneop.org for all of our programs, not just lifespan caregiving events as well. And what we'll do is if we can go back to, I think, that CE page, we'll kind of leave it there. Um, thank you. And we'll leave that page here in case you want to go ahead and get the last minute information. We have just a couple of minutes before we close out. And so we'll stay on for just a couple minutes for you to gather any last minute resources. Dr. Foster, I'm not seeing any additional questions, just a lot of great comments about a wonderful webinar that you've provided. But if you have any last minute comments or things for participants, I'll go ahead and go on mute now.
Thank you so much for having me today, and thank you each for engaging in this conversation. I appreciate all of your comments. But yes, please feel free to reach out to me if you want to have any follow-up discussion. Please utilize those slides and those resources that were shared.
Perfect. Thank you all. I'm already starting to get lots of copies of the CEs come through, so it's good to hear and see those copies come through because it means that y'all are able to access them okay and get through the survey process. Again, I'm going to go ahead and post my email address. If you have any questions or comments, need any tech support, feel free to reach out. We're going to go ahead and close out here in the next 60 seconds, probably. So hope you all have a wonderful rest of the day and a happy Thanksgiving from us. I know it's we got a couple weeks yet, but we may not see you or hear from you for the next couple of weeks. So happy holidays to you all.